Next module, risk management and mitigation strategies. Risk management is a critical aspect of project management in health information technology. It involves identifying, assessing, and mitigating risks that could potentially impact the success of health IT projects. Effective risk management not only helps prevent issues but also ensures that the project remains aligned with its goals and objectives, ultimately leading to improved patient outcomes and organizational efficiency. This module explores the fundamentals of risk management, key strategies for identifying and mitigating risks, and best practices for implementing a robust risk management process in health IT projects. Firstly, understanding risks in health IT projects. In the context of health IT, risks can arise from various sources and can significantly impact project timelines, budgets, and overall success. Common types of risks include technical risks, operational risks, regulatory and compliance risks, financial risks, stakeholder risks, and environmental risks. Firstly, technical risks. These involve challenges related to the technology being implemented, such as integration issues with existing systems, software bugs, data migration, and technology failures. Next, operational risks. Risks that impact day to day operations, including workflow disruptions, resource shortages, or changes in staff roles due to new technology. Next, regulatory and compliance risks. Changes in laws and regulations affecting health IT, such as HIPAA compliance, can pose a significant risks if not managed correctly. Next, the financial risks. Budget overruns, unexpected costs, or funding shortages can affect the project's viability. Next, stakeholder risks. Inadequate stakeholder engagement or resistance to change from clinical staff can hinder project success. Next, environmental risks. External factors such as changes in the healthcare landscape, market conditions, or advancements in technology can also impact project timelines and objectives. Next, the risk management process. Effective risk management typically follows a structured process consisting of several key steps. These include risk identification, risk assessment, risk response planning, and risk monitoring and control. Firstly, risk identification. This initial step involves systematically identifying potential risks that could affect the project. Techniques such as brainstorming sessions, expert interviews, and SWOT analysis, also referred to as strengths, weaknesses, opportunities, and threat analysis, can help uncover possible risks. Next, risk assessment. Once risks are identified, they need to be assessed based on their likelihood of occurrence and potential impact. This assessment helps prioritize risks, allowing the project team to focus on the most significant concerns. These include qualitative risk analysis and quantitative risk analysis. Firstly, qualitative risk analysis. This involves categorizing risks based on their probability and impact using a risk matrix, which helps determine the relative importance of each risk. Next, quantitative risk analysis. This method uses numerical data and statistical techniques to measure and analyze risks, estimating their potential impact on project objectives quantitatively. Next, risk response planning. For each identified risks, develop response strategies to mitigate their potential impact. Common responses include avoidance, mitigation, transfer, and acceptance. Firstly, avoidance. This includes changing project plans to eliminate the risk altogether. Next, mitigation. This includes implementing measures to reduce the likelihood or impact of the risk. Next, transfer. This includes shifting the risk to a third party, such as outsourcing a service or purchasing insurance. Next, acceptance. Acknowledging the risks and deciding to proceed, often with contingency plans in place to address it if it occurs. Next, risk monitoring and control. This ongoing step involves tracking identified risks, monitoring residual risks, and reassessing risks throughout the project lifecycle. Regularly updating the risks register and revisiting mitigation plans ensures that the project remains proactive in addressing potential issues. Next, mitigation strategies for common risks in health IT projects. To effectively address specific risks often encountered in health IT projects, organizations can implement targeted mitigation strategies such as technical risk mitigation, operational risk mitigation, regulatory and compliance risk mitigation, financial risk mitigation, stakeholder risk mitigation, and environmental risk mitigations. Firstly, technical risk mitigation. This includes conducting thorough testing and validation of software before full implementation. Building strong partnerships with vendors can also provide access to technical support and warranties. Next, operational risk mitigation. This includes engaging staff early in the planning process to gather input and feedback on proposed technologies. Comprehensive training programs can help ease transitions and reduce resistance to new systems. Next, regulatory and compliance risk mitigation. This includes staying updated on changing regulations and involving compliance experts in project planning. Conducting regular audits to ensure ongoing compliance throughout the project. Next, financial risk mitigation. This includes developing a detailed budget that includes contingencies for unexpected costs and regularly reviewing expenses and aligning financial practices with project goals. Next, stakeholder risk mitigation. This includes maintaining open communication with stakeholders, providing regular updates, and addressing concerns promptly. and involving stakeholders in decision making process to foster buy-in. Next, environmental risk mitigation. This includes monitoring trends in healthcare technology and policy changes to anticipate potential impacts on the project, and developing flexible plans allowing organizations to adapt swiftly when faced with external challenges. Next, best practices for risk management in health IT. Implementing best practices can enhance the effectiveness of risk management efforts in health IT projects. Firstly, by establishing a risk management framework, fostering a risk aware culture, regular risk assessment meetings, utilizing risk management tools, documenting everything, and engaging stakeholders in the risk management process. Firstly, establishing a risk management framework. This includes creating a standardized framework for identifying, assessing, and managing risks that can be applied consistently across projects. Next, fostering a risk aware culture. Encouraging a culture within the organization that emphasizes the importance of recognizing and communicating risks. This involves training staff at all levels to understand their role in the risk management process and the importance of reporting potential risks as they arise. Next, regular risk assessment meetings. This includes scheduling frequent meetings to reassess the project's risk landscape. This ensures that new risks are identified and existing risk mitigation strategies are evaluated for their effectiveness. Team members should be encouraged to discuss emerging issues and contribute to the risk management process. Next, utilizing risk management tools. Employing risk management softwares can help streamline the identification, assessment, and monitoring of risks. These tools often come with features that allow you to create risk registers, track mitigation action, and generate reports to share with stakeholders. Next, document everything. Maintaining detailed records of identified risks, assessment findings, response strategies, and outcomes. Proper documentation provides a reference for future projects, helping to inform and refine risk management practices based on past experiences. Next, engaging stakeholders in the risk management process. Including stakeholders in risk discussions not only informs them of potential issues but also opens the door for collaborative problem solving. Stakeholders may have valuable insights into the risk factors or suggestions for mitigative actions based on their experiences. Next, the role of leadership in risk management. Effective risk management requires strong leadership to guide the process, facilitate communication, and foster a culture of accountability. This includes leadership commitment, empowering team members, and communication from leadership. Firstly, leadership commitment. Leaders must prioritize risk management efforts and allocate resources for training, tools, and time to address risks. Demonstrating organizational commitment to risk management reinforces its importance across the team. Next, empowering team members. Leaders should empower team members to take ownership of risk management by encouraging them to identify risks and contribute to developing mitigation strategies. Fostering a sense of responsibility ensures that risk management becomes an integral part of the day to day operations. Next, communication from leadership. Leaders should openly communicate about risks and the strategies in place to manage them. Transparency fosters trust among team members and stakeholders, allowing for a more proactive approach to risk management. Next, evaluating the effectiveness of risk management strategies. The effectiveness of risk management strategies must be evaluated regularly through performance metrics, post project reviews, and continuous improvement. Firstly, performance metrics. This includes establishing key performance indicators, also referred to as KPIs, related to risk management, such as the number of risks identified, the response time to risks, and the success rate of mitigation actions. Monitoring these metrics helps gauge the effectiveness of risk strategies. Next, post project reviews. Conducting reviews after project completion to assess the effectiveness of risk management throughout the project lifecycle. Gathering feedback on what worked well and what didn't allows organizations to refine their risk management processes for future projects. Next, continuous improvement. This includes incorporating lessons learned from previous projects into future risk management strategies. This iterative approach promotes evolution in risk management practices and enhances organizational resilience. Next, conclusion. Risk management and mitigation strategies are critical components of effective health IT project management. By systematically identifying, assessing, and responding to risks, health IT professionals can minimize potential disruptions and ensure the successful delivery of a project. Developing a robust risk management process involves fostering a culture of risk awareness, engaging stakeholders, and utilizing practical tools and best practices. With strong leadership guiding risk management efforts, organizations can enhance their ability to navigate the complexities of health IT projects effectively. As the healthcare landscape continues to evolve, the ability to anticipate, mitigate, and adapt to risks will be a key differentiator for successful health IT projects, ultimately leading to improved patient care and organizational efficiency. By prioritizing risk management, health IT professionals can contribute significantly to the success and sustainability of their projects and organizations. Thank you.